to you today about something that you are hopefully passionate about, your health. Specifically, I'm going to discuss two ways in which you can measure yourself. One is weight, and the other one is your waist to hip ratio. One of these can show you where your health is at and whether your health is digressing or improving, and the other one tells you very little about your health. But before we get into these measurements, the question should be asked: why should you measure yourself? When you're driving, you're likely using a couple of measurement tools: a speedometer, a coolant gauge, and a navigation system. And all three of these tools provide you with one basic thing: feedback. With that feedback, you'll know whether or not you're going too fast and may get pulled over by the cops, whether your engine's overheating and you may break down, or whether you are lost or at risk of getting lost. And thanks to all those feedback tools, they save you time, minutes and hours. And if you care about those minutes and hours that you save through the tools that you have with your car, then you should definitely care about the months and years that you can save by getting effective feedback on your health. As mentioned, I will discuss weight and waist to hip ratio. As I said, one is very effective for describing where your health is at, and the other one is not. What you see here are the results of a study that was taken over 4 decades in the United States. What they took were the death rates in each weight group and ranked them in order. And what you see, starting with number 1, is the lowest death rate, and it goes all the way down to number 4, which are the highest death rates. There are 2 things I think are noteworthy in these results. First, overweight people have lower death rates during the time period than people of healthy body weights. And the second thing is that that space between numbers 3 and 4 is not a mistake. I intentionally placed it that way because numbers 1 through 3, the death rates are not that different. However, when you get to being very obese or very lean, that's the only time that your weight can tell you what your death risk is. Otherwise, your weight tells you almost nothing about how long you'll live. Here are the results of a different study, a study with 27,000 people from 52 countries. What they did was they looked at the heart attacks that occurred during the study, and then split up the people into groups based on weight, and then re-split the people up into groups based on waist to hip ratio. Now, the 20% with the heaviest weight were 44% more likely to have a heart attack than the 20% with the lightest weight. And I started that because when they looked at waist to hip ratio, and they took that out as a factor, weight basically showed no difference in groups. Essentially, that 44% is explained if just by looking at the waist to hip ratio. When they looked at everyone in the study and broke them into fifths based on waist to hip ratio, the fifth with the highest waist to hip ratio was 252% more likely to have a heart attack than the people, 20%, who had the smallest waist to hip ratio. If you're worried about your risk of having a heart attack, which one are you going to look at? Now, when it comes to diabetes, what they've seen in research is that the amount of abdominal fat that you have indicates your risk of having or getting diabetes. But your thigh fat, and also hip fat as well, shows no ability to predict whether you have it or will develop it whatsoever. Why is this important? People often lose weight, and they'll lose it from spots like their hips and thighs. And then when they regain the weight, it'll go into their midsection. If you're just looking at the scale, your weight's going to be the same if you lose 5 pounds from your hips and thighs and gain 5 pounds in your midsection. However, your waist to hip ratio will tell you that your risk of getting diabetes has increased. Your waist to hip ratio also is effective for telling you if your blood sugar is high and if your triglycerides are high. And in case you're not familiar with those are risk factors for heart disease. So why is waist to hip ratio so effective for determining or describing what your risk of disease is? Location, location, location. It's not just a business phrase. When it comes to your health, the location of your body fat is more important than the amount of body fat that you have. not all fat is created equal. There's visceral fat and subcutaneous fat. Visceral fat is basically the fat that's around your organs, that's in your midsection. It's mainly producing proteins that cause your body to increase inflammation. Subcutaneous fat, that's fat under your skin, that's the fat that you can pinch on your thighs, your arms. That fat produces proteins that decrease inflammation in your body. It also works as a buffer. And what I mean by that is that there are fats floating in your blood. And if you have a lot of subcutaneous fat, that fat will take the fat from your bloodstream and store it. If you don't have a lot of subcutaneous fat, that fat is going to get stored around your organs in the visceral fat. The subcutaneous fat also produces an enzyme that helps control your blood sugar. Now, if you want to measure your waist to hip ratio, what I recommend is that you do this once every 1 to 2 months. This is an effective way to tell whether your health is improving or digressing in between your yearly blood test. What you'd want to do is take 2 measurements at your waist, basically at the narrowest point of your waist. It should be just a little above your belly button. You're going to average the 2, and then you're going to take 2 measurements at your hips. And the hips are the opposite. You actually want to go at the widest portion of your hips. Then you're going to divide the average of the waist measurement by the average of the hip measurement. And as far as what the numbers mean, here are the recommendations for what's in an ideal healthy state and then a high-risk health state. Now, I'm not saying you should throw your scales out. Scale is still important for a number of ways. If you're on a fat loss program or if you're looking to add muscle, a scale is a decent way to determine whether your program is working. However, if you want to look at your health and wonder, are you at risk for a heart attack? Are you at risk for diabetes? Are your risk factors for heart disease in spots where you want them to be, or are they indicating that you're at risk for heart disease? Your waist to hip ratio is the way to go. Thank you.